Whenever you travel outside of Canada, it's important to have health insurance coverage in case you get sick or have an accident.
But even if you have travel insurance, you still need to make sure your health is considered stable and that you're fit to travel. Here's Pat Foran and Consumer Alert.
A man went to Florida this spring to spend time with his family, and when he was flying home, he suffered cardiac arrest at the airport. He felt he had the proper insurance, but after his hospital stay, his claim was denied, and he now owes more than $600,000.
Why I was in shock, I cried.
73-year-old Richard Bishop of Tecumseh near Windsor is happy to be alive after suffering a cardiac arrest while visiting Florida. In March of this year, he was at the Orlando airport waiting to fly home when he collapsed. It took 14 minutes of CPR to revive him.
I had 10 broken ribs, and that I'm recovering. I'm moving now, and I'm good.
The Bishops have group travel insurance and checked to make sure they had coverage before they left Canada. When Richard was hospitalized, he needed a defibrillator, and as far as they were concerned, all the bills were covered.
I provided them with the phone numbers to our doctors, his doctors, cardiologist.
The total hospital bill came to $620,000, and that's when the Bishops found out they were not covered due to Richard having pre-existing conditions related to his heart.
Cardiologist said that husband wasn't stable to travel.
The family said if they would have known sooner the hospital bill would not have been paid, they would have taken an emergency flight home to have Richard's health addressed in Canada.
After you get a $80,000 American defibrillator, they say, oh, we're not paying.
A Green Shield spokesperson said due to privacy concerns, they couldn't get into specific details, but did say, we can confirm all claim decisions involve multiple levels of review with both internal claim examiners and external medical experts.
If you do not declare all your conditions, you are subject to having the claim denied.
Martin Firestone says a change in medication, a doctor's visit, or pending medical tests are all enough to void an insurance claim.
Just to think you have travel insurance, it's just not enough in this time. You have to be careful to understand what you really do, in fact, have.
The Bishops say they aren't sure how they'll pay the huge hospital bill.
I feel terrible that we had no assistance being flat on my back in the hospital.
Firestone says in most cases, if someone owes a hospital bill in the U.S. at $600,000, often you can negotiate a lower amount. If you tell the hospital your claim was denied, you could pay hundreds of thousands of dollars less. On your side, I'm Pat Foran.
If you have a consumer story idea, email us at alert@ctv.ca.